Medical Centre has been servicing the Taree community for decades, and we do have a long-standing team. We currently have 9 GPs and 4 nurses, 9 admin staff. We've recently expanded. We now practice over 2 locations, so 54 and 63 Wynter Street. Wynter Street Medical Centre has approximately 12,000 active patients. We service all ages. We do childhood immunisation, so obviously we see babies from when they're newborns, and we also see elderly patients. Our GPs even service the residential aged care facilities in the Taree area. Wynter Street Medical Centre understands the importance of vaccinations, so we want to make sure that a vaccination experience is a good experience with our practice, particularly for little ones, because we want to make sure that they come in and aren't frightened.
A challenge that I have faced recently is immunising young babies and children. So to overcome that, we use distraction methods, such as a dragon that we can interact and it flies from the roof, or a bubbles machine that has lights and flashing sounds. Each day, we have new babies, new parents come through and their child require vaccinating. So just keeping the child calm, the parent calm, makes the process easier for everyone.
The use of distractions has greatly benefited us as well as the patient and the parents as well. The parents play a huge role in keeping the child distracted and being able to hold the patient or the child still, so we're able to vaccinate them quickly and efficiently.
Parents are really impressed with especially the bubble machine. Yeah, they do make comments about it, and it even distracts the parents because they're too worried about distracting the child. That it's a good outcome for all.
The challenge lately is a lot of overseas patients and their childhood immunisations, so trying to translate them in between their nationality or their language and into English. So we work closely with population health to try and get those translated. The issue is some of the words aren't the same in English, so in that case we have to revaccinate. We also had some COVID certificates from overseas as well that we had to add on to the Australian Immunisation Register. So those ones we had to make sure they had a specific criteria on the certificate. It was important for us to be able to add these to the register for those overseas patients, for the simple fact that they weren't able to go to the supermarket or do anything that they enjoyed, or work if they were here for work, without recognition from the Australian Immunisation Register that they were in fact vaccinated.
Wynter Street Medical Centre has embraced the current changes to web services. Just basically it helps us help our patients better by having immediate access to their records.
We used to have to log on to PRODA and then log on to each individual patient through their doctor access to be able to find the immunisation history from the register. But now they've done the update through Medical Directive that we're able to simply click on a tab in their patient file in our Medical Director and it's just there. And we're able to download statements on the spot.
Now we can just store locally from our actual software, which is also great for COVID vaccines if they've had their booster dose elsewhere, or it's also good for immunisation recalls because it's all on the one spot. We can see if they've been vaccinated in a community clinic or somewhere else, and we know they're up to date. We get several phone calls a day from a patient asking when they last had a tetanus or an injection, so now it's a lot quicker for us to just go into their actual file and access immunisation history through there.
Overcoming the challenge has been a huge benefit for us as nurses, as a practice, for our doctors, but more importantly for our patients, the efficiency of vaccines for them.